Dr. William, really appreciate you taking the time to connect with us from your practices to share your experience with ZipE. After several cases, what changes for you?
Well, at first, this implant really changes what we're used to as orthopedic surgeons and what we're taught in residency. Initially, we're taught that the fixation has to come from the bone, but the ZipE implant changes that around and it really allows you to bring control from the tendon itself instead of the bone.
And what does that change in practical terms?
Well, it really changes everything. Instead of concentrating your force through the suture, which then goes through tendon that's already deficient, you're distributing this load across the tissue and giving you better contact, more stability, and you're actually protecting the tendon instead of potentially harming it.
What do you feel during the repair?
In general, the construct feels a little more balanced. The tendon is compressed in a controlled way. It's not being strangulated, it's not being pulled or stretched. It's an entirely different feeling than what we're used to, and it's a different quality of fixation.
Clinically, what do you think?
Clinically, we tend to see a little more confidence from the patient earlier on. They move better, they move sooner. The repair feels like it can handle the load better. And it's not just holding the tissue, it's actually being an anchor, it's holding it.
My last question is, where does ZipE fit?
I think ZipE is kind of the missing link with anchor-based repairs. As I said earlier, the typical anchors fixate the bone, whereas ZipE really concentrates on fixating the tendon. It shifts that mechanical load onto the tendon because your successful repair isn't just about the fixation. It's about how the tissue carries the load and restoring that ability of the tendon to do so. And I think ZipE accomplishes that for us.
Thank you, Dr. Williams, for sharing your experience in this international interview. Thank you for that.
You're very welcome.